Thank you, everybody, for coming to the Awake and Thriving podcast. Today, we have with us Dr. Woon, all the way from Hong Kong. She's a Canadian licensed naturopathic doctor specializing in women's health. Thank you for coming. Thank you for waking up early to be on the show. I appreciate it.
Oh, thanks for having me.
So I know that you specialize in women's health, and it's something that I've been paying more attention to. I suppose like most women as they get older, and as I've gotten into my later 30s, I've noticed not really maybe I pay attention more to my body, just like hormones changing with stress. Maybe it's just so much stress as we get older. And I've never taken the naturopathic way of even controlling my hormones or any of that. So what do you usually start off with if somebody comes in thinking they have hormone imbalances?
So with hormone imbalances, I take a thorough menstrual history with a lot of women. So we start off by asking, is your cycle regular? How many days of bleeding, how heavy it is, whether they have any cramps, what's the color of their blood? We go deep down into, what are some PMS symptoms, like breast tenderness, like mood swings, any bowel changes and headaches or migraines or, any swelling or, fatigue happening, before a period kind of thing. So we do a really, thorough assessment of your cycle. And then we also look at any digestion issues, your sleep, your stress. We do a very thorough intake in our initial visit to get an understanding of where the patient stands and how can we support the whole person versus trying to, treat the symptoms alone.
Okay, so you start at the root cause.
Mm-hmm.
Okay. And how long do you dispense herbal medication, or is there hormone replacements that you usually recommend? And the reason why I'm asking is because from a naturopathic approach, I wouldn't know what to expect.
Yeah, so it would depend on different trainings that a particular naturopathic doctor has gone through. There are naturopathic doctors who do bioidentical hormones. I personally don't do bioidentical hormones. I err on the side of, looking at nutrients, repleting the nutrients, and also using botanical medicine. Sometimes I would use homeopathy. So it's like very eclectic way of practicing.
Perfect. And then, you know what, just to backtrack a little bit, I was reading about your story and kind of how you had, is it ITP? Is that correct?
Yeah.
And that is close to home for me because I believe my cousin's daughter has that. And that's when you bruise easily. Is that true?
Is that right? Yeah. So it's idiopathic thrombocytopenia purpura. So it's like when you have low platelet levels and you tend to bleed easily, bruise easily, have difficulty clotting, that kind of thing. Yeah.
And so what did you go about, or what did you seek in order to kind of reverse that or make that better for you?
It was a very interesting experience because, my levels were, so the typical healthy levels of platelets is higher than 150. My levels were hovering around between 70 and 90. And once I got pregnant with my son, I was referred to a hematologist because during pregnancy, basically your blood gets diluted and then the platelet levels will further drop. And that can be a big risk when you're giving birth to a baby because, if you don't clot and literally end up with a hemorrhage, and that could also put you at a risk, right? So they were constantly monitoring my platelet levels every month. So I was drawing blood every month and seeing a hematologist, following up with them. And to my surprise, there at 20-week mark, we were doing basically anatomy ultrasound, and they found something abnormal on my son. So we were kind of all freaked out. It was my first pregnancy. They were doing all these kind of testing. I was sent to genetic counseling. And at one point, my midwife was having this conversation with me about terminating pregnancy, and everything got really super scary all at once. And that's when I started praying. So I was leaning on into my spirituality side of things and, literally was praying every single day for the health of my baby. And that kind of spiraled into, thinking about other people dealing with infertility, my cousins, like my sister-in-law, and, those who have miscarried and all kinds of things. Like you started to, pray for other people as you start to pray for your own, right? And funny enough, I went through a very long, difficult stage in my first trimester where I was literally vomiting everything because I had a very severe pregnancy nausea. So I was not able to even really intake a good nutritious meal or even, swallow down a prenatal vitamin at that point. But funny enough, as things got better, I started to really focus better on my diet, obviously take better care of myself because I really wanted this baby to be healthy. After a series of testing, they did say everything was clear, it doesn't seem like there's something wrong with the baby. And that was a big relief, but I continued to focus on my health and nutrition and try to take really good care of my body. And towards the end of the pregnancy, my platelet levels actually normalized. And the hematologist was like, what did you do? I've never seen this in my entire career. And I just shared what I've done. And, obviously he was not like, it's not something that is like mind blowing. It was like, oh, really? Right? It's just like doing the basic stuff, but it made such a huge shift in my platelet levels and my health. Right. So at the end, everything became okay. Yeah. And one of the background story for that is with idiopathic thrombocytopenia, it's like your immune cells basically attacking your platelets, right? So it's an autoimmune condition. And during pregnancy, there is some shift in the immune system, right? So I think, maybe I got the benefit of that and took advantage of that, and things kind of shift for me for the good side. So yeah, it's a very interesting story to share because it's not something like revolutionary that it's some kind of, treatments got me out of it. It was like me focusing on the good side, the positive side of things, and doing really basic modification in terms of dietary and lifestyle. Yeah.
So do you still have ITP today?
No, I don't. So since then, things shifted for me, and my platelet levels have been within the normal range. Yeah.
Oh, wow. Okay. And have you had subsequent pregnancies since?
Yes, I did. I had my second pregnancy as well. Thankfully, I didn't have to go through that again.
Oh, well, that's good. That's great, actually.
Yeah.
And then I know that we discussed before, a lot of women unfortunately have trouble with fertility. What is it that you usually, I know this is kind of broad because everyone's a little bit different,
Mm-hmm.
but what do you usually look at, recommend? What do you usually see maybe as one of the major culprits for maybe infertility? I know that can be a controversial topic, but what do you think about all that?
So there's so many causes of infertility. So just to name off a few, PCOS is a big thing that oftentimes is the issue with a lot of women. PCOS is a condition where women have difficulty ovulating, having regular cycles. So obviously that is going to be a major barrier to getting pregnant, right? Another condition that I often see is hypothyroidism. So that can also, just a little bit of underactive thyroid can also massively affect the fertility chances. So, sometimes I was able to diagnose subclinical hypothyroidism where, the patient doesn't really present with much symptoms, but on a blood test, even their levels, according to normal standards, it's quite normal, but according to fertility standards, it's a little bit underactive. So when we catch that early on and support thyroid function, we're able to achieve pregnancy, that kind of thing, right? So another that is common is also a miscarriage due to progesterone deficiency. So progesterone is the hormone that helps maintain the pregnancy. And oftentimes when that is low, women have difficulty maintaining pregnancy, often losing their pregnancy during the earlier first trimester. So being able to support that through often helps women able to, have a full term and then deliver a healthy baby, right? So, those are, I guess, top three that I've seen in my practice, but obviously there is going to be so many other factors. Sometimes I have also seen women with premature menopause. So we often call that ovarian insufficiency, where women who are young in their even late 20s, in their 30s, or when they test their hormone levels, we find them approaching menopause almost, right? So we often have to work with that as well. So, there are basically the barriers to, getting pregnant is first, we have to see, is the woman ovulating? Is she ovulating? Is she regularly ovulating? And if she's not getting pregnant, how is the equality? Is there a room for improvement? How can we do that, right? So there are so many ways to do that as well. And lastly is, can we help this woman to maintain pregnancy? So is this an issue for this woman, right? So that's where the progesterone comes in.
Yeah, because I know of even women, like you said, like in their late 20s, early 30s, and they're not on any form of birth control for a couple years with their husbands, and they can't get pregnant. and they want to get pregnant. So they're not trying not to.
Yeah.
And they just can't hold or get a pregnancy to stick.
Exactly. So that's why, asking about the menstrual history gives us a lot of information. So first of all, we in order to achieve optimal fertility, we need to have a regular cycle, right? So if the period is irregular and we cannot expect when to have sex to have a baby, that is going to be a problem, right? So, oftentimes what I tell my patients to do when they say, oh, we're thinking of getting pregnant, or we've been trying for some time, but we haven't been able to achieve pregnancy, can you help? The first thing that I would ask women to do is start BBT charting. So basal body temperature charting. So that's what I recommend.
Oh, so you think the temperature charting is more accurate than, because there's menstruation calendars, and I have one as well, and it's pretty accurate for me. I just changed birth control, so that's been a issue in itself. It's actually made my period longer, which I loathe, but for the most part, I'm still on time on that, and it would tell me when I ovulate as well. But you're saying that the temperature one is more accurate for ovulation?
So if I know correctly, those, they kind of estimate when you are going to be ovulating, right? So what the basal body temperature charting can do is, the basal body temperature is like the lowest body temperature can be measured first thing in the morning while resting, right? So just before you get up, you will just basically measure your temperature, ideally on the same time each day. So what this temperature monitoring can do is that, pre-ovulation, your temperature is going to be at around a set range, right? And then post ovulation, your temperature is going to go up, right? And by tracking that, we get to, accumulate some data. So some of the data is going to be first, the length of your follicular phase. That is the first phase of your menstrual cycle. That is from day 1 to ovulation. Now, it also gives us idea of how long is your luteal phase, which is post ovulation to end of your cycle, right? And depending on the curve and the trend that we see, we get to identify, oh, this woman is not making progesterone efficiently, right? So if there's not a sharp rise in temperature and the temperature kind of staggers and rise very gradually, we can kind of step in and start supporting the woman's progesterone production, right? So that is some ways that we can do more targeted treatments. And also depending on the length, we can also suspect, oh, I think this is not enough length to be making a high quality egg. Maybe I think, we can step in here and help this woman to improve egg quality here. Or if the luteal phase is too short, that can also be a sign that the progesterone might be too low, right? So there are some ways that is beyond ovulation that we can get a sense of by doing BBT charting. And also in terms of ovulation, the temperature rise after ovulation, right? So we don't necessarily get a sense of, okay, today is a good day to have sex. Like BBT charting doesn't give you that information. It's more of like seeing an overall trend. And based on maybe 2 consecutive months, we get a sense of, okay, these are the days that is most likely that the woman will be ovulating. So, these are a good time to have sex, right? So, that those kind of overall trend and information can be gathered through BBT charting. So it can be useful in that sense, yeah.
Okay. So depending on how long a person's menstruation is, can actually impact how healthy their egg is?
So depending on different phases of the menstrual cycles, because there is 2 phases to the menstrual cycle. The first is the follicular phase. This is the phase when you are maturing your follicles to produce a healthy egg. So this is between day 1 to day, let's say ovulation, like around 14. The ovulation day can be different for every woman, but let's say it's 14. So day 1 to 14 is follicular phase. The next phase is the luteal phase, where you release the egg, you ovulate, and then your egg either meets the sperm and implant and maintain pregnancy. So that is the luteal phase that we're talking about. So this is going to be, day 15, let's say, to day 28, if that is the cycle length of that woman, right? So yeah, so it allows us to, see kind of like how long are different phases of the cycle. And depending on the length, the length can give us some information. The fluctuations can also give us some information as well, like I said, yeah.
So if a woman is having trouble keeping a pregnancy due to progesterone being low, you're able to supplement that through pregnancy for them. They're able to take those kind of hormone supplements, help and be healthy still.
Yeah, so this is not like a hormone supplement. This is more, I approach it from nutrient standpoint. So there are certain nutrients important for making progesterone. So the primary ones that I'm going to say would be magnesium, the B6. So these are going to be the building blocks that helps our body produce more progesterone. So the way I work and naturopathic medicine work is that we are basically working with our body's innate intelligence to be optimal and achieve balance, right? So we're working with different mechanisms and different cofactors and nutrients that can help augment and support the production of these hormones. So that's how that's often has worked really well with a lot of patients that I've seen. I had a woman who was diagnosed with PCOS, had a first miscarriage and came to see me to work together. She was doing her BBT charting on her own, which was like a super, I was like so happy because that really facilitates and speeds up the process of, working together. And based on her BBT charts, I was able to note that her progesterone was staggering. And also she was having spotting during her entire first pregnancy up until the miscarriage, right? So we suspect that she was having low progesterone. She was not making enough of her own. So we started supplementing with magnesium and B6. And the next cycle, immediately after that, she was able to get pregnant again. So, and I think she's approaching her end of her first trimester. And yeah, so she's pretty excited about that right now.
And you said magnesium and B6 help with their natural building blocks for progesterone.
Exactly. And the dosing also obviously matters, right? So it's better to, work with a naturopathic doctor who knows about, how much to dose, how can we support during this phase and all that.
Okay, perfect. And then moving into just the hormones, what kind of hormone things could someone look out for if they were like looking to get pregnant but haven't quite gotten there yet? Is there any signs that they should look for that maybe they might be having some trouble? Because I feel like women don't usually realize they are having trouble getting pregnant until they can get pregnant.
Yeah. So if you are over 35 and you've been trying for the last 6 months and haven't been able to get pregnant, oftentimes I recommend doing a fertility workup blood test. So the common blood tests that are worked up are FSH and LH, which is the follicle stimulating hormone and luteinizing hormone. So the first one helps the follicles grow into a mature egg, and and LH is responsible for ovulating that egg, right? So measuring those levels helps us gain information about is her FSH in the optimal range for optimal fertility, or is it too high approaching menopause? Is it too low? Or is LH too high, and the FSH and LH ratio indicates that she might be PCOS, right? So those information can be gathered from testing those two hormones. Also, testing for estrogen can give us an information: is the estrogen too low to produce a healthy egg, or is it too high and causing problems? We can also test for testosterone, especially for women who are having irregular cycle, longer cycle, not ovulating in women with PCOS. Is going to give us some information there. DHEA is also often tested as well, and prolactin. So prolactin is a hormone that is stimulated when the woman is breastfeeding and nursing. Sometimes there can be a tumor in the brain that is stimulating that hormone and preventing women from getting pregnant as well. So oftentimes it's a good test to kind of run and rule out that possibility as well, right? Other tests to run are TSH and T3, T4, which is the thyroid hormones as well. So like I said, just a little bit of underactivity in terms of thyroid function can affect fertility, right? So it's important to test for the TSH, but also T3, T4, because we want to see the conversion, whether, is the inactive T4 being converted well into T3, do we have enough of T4 and T3, that kind of thing, right? So based on that information, we'll be able to help optimize the thyroid function as well. So these tests, ideally, you want to run it on day 3 of your period. So that is going to be the day 3 of your bleeding, right? So when you do this test, that's like the basic gold standard for fertility testing, and the doctors will able to kind of interpret your results, offer more strategic treatment plans from them.
Okay, from those results from day 3. So all of those testings are usually done on day 3 of your menstrual cycle?
Yes, for the ease of testing, yeah. So day 3 will be the way to go. Yeah, day 2 to 3.
Is there any vitamin supplements that you think are best for a woman to start if she's thinking about getting pregnant in the next 6 months to a year and she doesn't know about her fertility quite yet, besides like folic acid and that kind of stuff?
Exactly. I'm glad you mentioned folic acid, is because that is often the, I guess, supplement that patients would get themselves on it because they heard about it so much. But I actually tell my patients you don't want to be taking folic acid, not in that form at least, because the form really matters, because about 50% of the population carries a particular genetic variant called MTHF. So if you carry MTHF mutation, then what can happen is that you are not good at converting folic acid, which is synthetic form, to an active form that gets utilized inside the body, right? So the form that I actually recommend people to look out for, whether they're purchasing just folic acid alone or they're looking for prenatal vitamin to take, is look for the right folate form, which would be 5-LMTHF. So yeah, so that would be the form that I would recommend people to look out for.
And what is that again? 5?
LMTHF, methyl tetrahydrofolate. I think that is the full name of that.
And that, I don't think I've ever seen that before, but I haven't looked. So
Yeah, most of the professional brand prenatal lines would now carry 5-LMTHF form. So you would see under folate, you would see in brackets what form it is. If it says folic acid is a synthetic form, which is cheaper to manufacture, so obviously it's more prevalent in over-the-counter products. But if you want to actually get the right form that your body is going to utilize more effectively, you want to make sure that that form is in 5-LMTHF. So that is the form that you want to look out for.
Okay, perfect.
Yeah, so because there has been studies shown, like for couples going through IVF, I think they've been trying it for like 3 years with no success. Basically, they changed just their folic acid form. So from folic acid to folate, and they gave it to both men and women. And after, I think, what they've noticed is that, some of the couples, without even going through artificial reproductive technology, was able to get pregnant, and the remaining couples were able to go through IVF with success after changing their folate, right? And most of these people were obviously some carriers of MTHF polymorphism. Yeah.
That's interesting. I've never heard of that before.
Yeah, so a lot of naturopathic doctors are advocating for the right form of folate to their patients, but I think the public still hasn't, reached the level where everybody knows about this, right? So I think we need to get the message across.
Yeah, definitely. Is there any kind of naturopathic, I don't want to say medications, but supplements that you recommend to women for, say, like menstruation cramps or anything like that? Or is it just maybe just changing their diet?
So when it comes to cramps, the first thing that I would look into is where is the inflammation coming from, right? So it becomes a really benefit to kind of assess the person's diet. So one of the things that I do during the initial visit is we talk about their diet in immense amount of detail. So we go through breakfast, lunch, dinner, and snacks, and we basically talk about the possible varieties that they are having on a day-to-day basis, right? And based off of that, I get a sense of possible inflammatory triggers in their diet. And we do like an elimination trial of removing those food for 4 weeks. And oftentimes that kind of removes the menstrual cramps entirely for a lot of women that I see. If that doesn't give women the full relief, oftentimes we have to look further, investigate further to see, is there any other health conditions that might be coming to play, such as endometriosis. And for that, we have to, bring in other supplements to reduce and control that inflammation.
Okay. I just mentioned earlier, I just changed to a different form of birth control, and I realized I've never had really bad cramps, and now I do. And that's been super frustrating for me because I just, within the last 2 months, not only did my period increase to 10 days versus before it was just 5, now I have really bad cramps with it. So I've been on the fence of actually just getting off of birth control again,
Oh no.
just to not have to deal with the bad cramping, because I know that it was it's directly associated with the birth control I'm on, unfortunately. Do you advocate for birth control, or do you just have, I know it's everyone's preference. I'm not sure how it is in Hong Kong, but I'm assuming like women just here, depending on what company you work for and what religion you are in, sometimes they don't pay for birth control here in America. But do you advocate for like natural ways, or is there certain birth controls that you see better results with?
So I advocate for hormone health. And from a hormonal standpoint, personally, I'm not a big fan of the pill. And there are a couple of reasons to that. Is first is that our body is so smart that once they start getting these synthetic versions of hormones, it basically shuts down its own production of hormones. So, we become dependent on these pills to regulate our cycle. And there is a possible, drawback to that is first is that when women are on the pill, they stop ovulating. And ovulation has benefits far beyond just getting pregnant. Because when women have healthy ovulation and they do ovulate every cycle, what happens is that they start making healthy levels of progesterone on their own. And healthy progesterone levels have been shown to, protect women from having dementia, protect women from having osteoporosis, breast cancer, cardiovascular disease down the road, right? So basically having an ovulatory cycle every single month is going to be, putting deposit into, long-term health bank account, so to speak, right? So, I always advocate for women's health and women's hormone health. That's why, from a grand scheme of things, I would say, if you can find a different way other than controlling women's hormone to, achieve contraception, that would be better.
Yeah, and I went to, because I didn't want hormones in my body either. That's not something I really wanted to do at all.
Mm-hmm.
So I got an IUD. I got the only IUD that doesn't actually have hormones in it.
Mm-hmm.
But it is also the one birth control that usually causes bad cramps and longer menstruation. Kind of dealing with that. I don't really have any hormones going in me from that, but I have to deal with the terrible cramps and the double 10 days period.
Exactly. So yeah, it's depending on different hormonal contraceptive. It doesn't work for every woman, right? So, sometimes we have to find other ways, is there better ways to do that, right?
Yeah, definitely. Is there anything that I didn't ask that I didn't know to ask you about naturopathic medicine and women's health? Any kind of pointers? Because I don't think a lot of women have really ventured into naturopathic doctors for women's health necessarily. Is there anything that you would like to add in just to maybe get them more interested in it? Because this is all about education for me. It's just educating the public about the options that are out there, that it's not Western medicine isn't the only option.
Exactly. So one of the benefits of, I think, naturopathic medicine is it really encourages women to really connect with their body and connect with their cycle, especially when it comes to women's health, right? So it's really literally helping your body work for you, not against you, because there's a lot of women, when they come to my practice, that they start feeling that their body is against them, that they're giving them so much symptoms, so much pain, and they feel so defeated by all these symptoms that is happening, or, not being able to get pregnant is also making them feel like, somehow their body is not working for them, right? So naturopathic medicine works by helping your body work smarter, right? By, tapping into the innate intelligence of your body to be able to heal and to achieve balance and work better for you again. Those are some of the strategies. When it comes to fertility, like I said, before you dive into more in-depth, like a transvaginal ultrasound or, cycle monitoring, or even, pursuing IVF. I think, if you want to do things a little bit more natural and more in alignment with your values, these are some of the things that you can look into, such as basal body temperature charting, or, having a thorough assessment with a naturopathic doctor about your menstrual history and getting a sense of, what may be the culprit of your infertility, right? Because there are so many other things that can be happening and maybe the factors that is preventing you from achieving pregnancy, right? So one of the other thing that I actually wanted to talk about is the partner, right? Because, fertility is not just about women having healthy egg, it's about also men having healthy sperms as well, right? So I think, they have noticed in the last 50 years, the sperm count has decreased about 50% in men, just overall average, right? And oftentimes a lot of men exhibits what is called oat syndrome, which is basically low sperm count, low motility, low morphology, right? So, all of these sperm parameters can also affect the chances of, getting pregnant. And also, if the sperm DNA is all fragmented and also damaged, this can also increase miscarriage as well. So, nowadays they say male infertility is actually 50% of all cases of infertility, right? So it is a big deal. It is the half of the puzzle, right? So I always advocate when it's always the female patients who comes into the door concerned about infertility, but I always, ask, has your partner been tested? Do you know anything about your partner's any parameters that needs to be optimized, right? So, that's another side of things.
Because as men get older, things change for them as well. So even though they may have had sperm that were great when they were in their early 20s, if they get older and they're trying to have children, things change for them just like for women, correct?
Exactly. And also it takes about 74 days to produce a new batch of sperms, right? It takes about 100 days for women to create a healthy new egg as well, right? So I always say, if you want to really optimize your chance of fertility, give it about 3 months of, cleaning up your diet, taking the right prenatal vitamin. Also, men can benefit from taking prenatal vitamin just on the side because sperms are very vulnerable to oxidative stress. So, some antioxidants are definitely going to help produce healthy sperms as well. Coenzyme Q10, I don't know whether you heard about it, but CoQ10 is also a really helpful nutrient for both egg and sperm quality. So that is something that you can also look into as well with your naturopathic physician or doctor.
You know what? I love that you brought in the male aspect because they've always gotten left out. And for years, I mean, if we were talking thousands of years ago, women used to get persecuted for having all these daughters when now we know that it was the men that chose that.
Yeah.
I love that you brought the male aspect in because I remember reading that statistic probably about a year or two ago about the sperm count for men now going down so drastically. That's terrifying. What's going to happen in another 50 years? We're going to be sterile.
And I also tell like little things count, even like something like lifestyle factors, like not keeping the cell phone in the pocket. This is going to be huge for men, and also not using your laptop on your lap is going to be also, preventing that EMF exposure, and that can also negatively impact the sperm parameters as well, right? So, those little habits, and also, sleep and stress plays a huge role in terms of both reproductive function for both men and women, right? So, managing those is going to be also key as well.
Good. I love that you brought that in. And yeah, see, I didn't even bring that up. And that is vital. Okay. Because I think for so many women, when they're going through this, they feel like it's all their fault. And if they haven't had their partner tested, it may not even be their fault.
Yeah. And just to give you like a very interesting just piece of information is that sperms can survive up to 5 days inside the uterus, and women has a fertile window of 24 hours, right? So, sometimes people think, oh, you only get a one shot of things, but that is not true because, if you have regular sex, even outside of that fertile window, the studies have shown that it actually increases your fertility chance as well, right? So sometimes, couples can end up feeling like, oh, they only set this one day out of this month or a week out of this month to have sex. And the sex becomes this ordeal of, trying to make babies. And that can really suck the joy out of having intimacy and pleasure from the sex alone, right? So, I actually recommend my patients that, try to, have sex regularly, even if it's outside of your fertile window, because, studies have shown that it actually primes the immune system of the mom, the female, to actually conceive the baby. So I think that's very interesting.
So the more they have intercourse, it primes the mom more?
Yeah, so the studies have shown actually sexually active women tend to have particular immune cells called type 2 T cells in their luteal phase, which actually, primes the environment in the uterus to not attack the sperms or the growing fetus inside the uterus, right? Because, our immune system, anything foreign that is outside of this body is going to be something that needs an invader that needs to be attacked, right? So, your immune system has to kind of differentiate between that. And apparently having regular sex increases this particular immune cells that actually protects the sperm and the embryo from being attacked by your own immune cells. So I think this is super interesting study to note, because for years there's been saying that, actually having regular sex, that is, although that may be not within the fertile window, it still has benefits. But now the studies have backed up why that is. And there's also other reasons why different types of immune cells like type 1 T cells and immunoglobulin antibodies are shown to be increased during the first phase of the menstrual cycle, the follicular phase, to keep the woman from falling ill, basically, or having infections by being able to fight off the virus or bacteria more efficiently, right? So there are so many intricate ways our body designed to protect us. And I think, we don't have to limit our intimacy and connection with the partner, because I think at the end, that is where baby is coming from, between the partner's intimacy and love for each other, right? So, sometimes when people go on this fertility journey for so long, sometimes, making the baby becomes the prime goal, and they just lose touch with the other side of things, right? So I think this is a good study, and also a good reminder to always focus on connecting versus, trying to, shoot for the star. Yeah.
Okay. Yeah, I like that, because I have heard that from couples as well, is when they're trying to have a child, it's like a job.
Yeah, it becomes a job and uninteresting, right?
Yeah. And it's terrible, because that's your partner. That's somebody you want to spend the rest of your life with, and it's not exciting anymore, or I don't know.
Sometimes just sharing this information gives a huge relief for a lot of couples that I get to talk to, because I'm like, oh, okay, we can actually, don't need to just obsess over this fertile period. We can actually start to, enjoy sex more, rather than feeling like it's a job that we need to get done each month. Yeah.
Yeah. And I think if they're stressed out in their relationship trying to do that, that doesn't help it either. Thank you so much for coming on. I've been interested in all of this just because 21 anymore, and I wanted to get some more info in a natural way. So I appreciate all of this info. This is great.
Glad it was helpful. I think, the last thing that I wanted to touch upon is basically, it's important to look at the whole person. And that's why we talked about, the areas that sometimes when it comes to reproductive health, people think, oh, they only want to focus on, their period, their cycle, and their ovulation and things like that. But we have to also look at the stress, right? If the woman is stressed out, that is going to shut down their reproductive function. We have to look at sleep, right? Because if you're not resting, then, that increases oxidative stress, and that can affect egg quality and sperm quality, right? So I think it's important to also note that, looking at the whole body function and how your whole body is supported is going to be also a very important factor in terms of achieving optimal fertility.
Yeah, I think the whole body approach just in healthcare in general will be revolutionizing. So I can't wait till that truly occurs and more people have access to it, because unfortunately most people that have access to that nowadays are people with means to pay out of pocket, because insurance companies usually don't pay for alternative or holistic healthcare as of right now. Is that true over there as well?
Yes, pretty much the same. Yes.
Well, we'll get there.
I agree. Yeah.
So once again, thank you so much. I appreciate having you on the show.
Thank you so much for having me. Have a great day.